Everybody, welcome to the Health Impact presentation here today. I really appreciate you guys joining us. My name is Brett St. Pierre. I'm with HID Global. We're pretty much a hardware manufacturer that focuses around identities for physical access control, logical access control as well. So today's session is Mind the Gaps, Busting Blind Spots and Building a More Secure, Responsive Healthcare System. So we have with us today, Ashley, I'll go around the room and let them introduce themselves. So Jim, why don't you go ahead and start as far as our panelists?
Jim Sawyer, Security Director, Seattle Children's Hospital. I've been in the business 45 years. I'm the state chair of the IHSS and former president of the Washington State Crime Prevention Association.
Thank you. And Colleen?
Hi, I'm Colleen Lyons. I'm site CIO for Lenox Hill Hospital located in New York City, part of a larger healthcare system, Northwell Health, which is about 23 hospitals. I've been here for about 8 years, and I've been in various healthcare IT roles for about 32 years.
Thank you. Doug?
I am Doug Murray. I'm from AltaMed Health Services. I'm the Information Security Officer. AltaMed is one of the largest federally qualified health centers in the United States. And I'm originally from Hyundai. I was the CISO at Hyundai for several years, and I'm glad to be here.
Well, thank you for spending the time today. Really appreciate your insight that you're going to share with the group. So we'll start off with Jim. So Jim, are there any new threats or vulnerabilities you learned about healthcare IT this year that surprised you? And then if you can share any best practices that you've had worth sharing with the group.
Yeah, well, some of the, I mean, COVID's probably reshaped, to say COVID's had a dramatic impact on healthcare is pretty much a vast understatement. I think the issues of for hospitals, healthcare across the country. Well, one thing is COVID-19 has been a huge shockwave, and I think there's a bit of a people are breathing easier now, thinking that we've gone past this and somehow we'll go back to the normality or the way things were. I'd put a huge asterisk next to that, just based on you know, what science is telling us about the possibility or likelihood of additional viruses, that thing. So I think one thing that I've seen that's impacted us is prior to COVID, we would, using a Lenox system, we would greet, authenticate, and badge over 625 people a day, every day. Everyone over the age of 12 would come in, we'd validate who they are. To me, there's two huge challenges in hospitals, healthcare, security today. One, you want to prevent violence, you want to do things that prevent gun violence. And two, you want to authenticate and validate and confirm who's in your building. We did that really well up till COVID. Then after we hit, we had to rapidly take it up a notch, where we'd have to not only validate and screen people, we'd have to test people, whether they were showcased any of the symptoms of that thing, and that ratcheted things up to a level we'd never seen before. And we were able to do it. We were able to do it, and there were, you know, there was some trial and error, but we're continuing that and looking at better ways to do that, temperature taking, the whole thing. And a big thing, even though it sounds mundane, is when you're doing this, when you're bringing in a huge influx of people, is we're a fast food culture. People don't like to wait. So you need to, when you employ these technologies, you got to make sure you're fast. You don't want long lines. You don't want people waiting in line a long time in health, especially in a hospital. That's just toxic. So those are just some of the things that, you know, from a snapshot of what we took a look at, what we addressed, and what we're continuing to address today. You know, there have been changes. We have multiple 4 or 5 entrances open. We screen and validate everybody who comes in, all patients, everything. That's ongoing. And that could be a protracted event that could go on 18 months to 2 years. at present where we're at now.
So I'd like to add to some of that, what you were saying, our experience in New York City in regards to like visitors during COVID, New York being pretty much the first epicenter. We sort of learned as we went and didn't have a lot of examples to go on. And that's exactly what happened to us. So, we ended up with lines out, on the sidewalk, being in the city. We were trying to get, visitors before COVID. It was like you walked into the hospital, you would just go to our security desk, you would say, I'm here to visit Colleen. And that was about it, right? It was a lot of trust in that visitor system, worked for years and without a lot of incidences. Then COVID, it was like, show a license, show an ID. We had multiple systems that, very quickly we tried to create these easy lobby things. We had people there for appointments at the same time. We had rules changing every day, like you could have 2 visitors, you could have no visitors, you can have 1 visitor on a weekend, and trying to keep track of that and to have a concierge, our patient experience team, trying to manage the volume of visitors. Having to track each one was so different for us versus the open door policy with our security, personnel before COVID. That worked, and now that doesn't. And we're not going to go back to that. And now we're trying to figure out what is the right mix of, do we have people pre-register on an app that we know, here's my QR code, I'm validated, I'm here for Colleen, it, and here's my quick ID, and you go through. So those are things that we're looking at. And like you said, COVID has changed things forever, that we won't go back to those original visitor policies. And then we had a lot of struggles with even figuring out our devices. We had iPads, they were on our guest network, they were on our wide area network. This didn't work with that. We couldn't load that. Our security teams also scrambling, saying we could do this, we can't do that. So it was a lot of things changing every 5 minutes for months. It was incredible.
Yeah, and I'll underscore that. And that to me is a kind of seismic impact. Just changing your visitation rules.
Yeah.
Just doing that, you can imagine. I'm a pediatric facility, children's hospital. When you tell a family they only have 1 parent there to see a really sick kid, I mean those rules would change, and they had to change. We had to adapt really quickly and convey that in a really positive fashion to families who did not want to hear it, who under just unprecedented stress. I mean, those rules and the impact it had on the entrance staff, the security staff.
Yeah.
To enforce that and maintain that in a positive light. I mean, that kind of thing probably would have made Gandhi an axe murderer, but we made it work.
Yeah.
And I think looking towards the future, we have to have that built into it, that we had the ability to move quickly, adapt, and alter visitation rules. Because like what was mentioned in New York, all those things happened, the long lines of people, where simple things like we employ 1,000 cameras, and if we had a parent who was positive and they somehow got in and were around 5 or 6 staff, we had to track down all those staff. We had to, and that was an ongoing thing. And I think looking towards the future, hospitals are going to have to build this into their disaster response plans, their emergency response plans. What if and how do we respond? Viruses, COVID is one thing. Catastrophic climate change is another, and those seem to be co-joined twins, or probably will be. But I think that point you can't emphasize enough, that having that ability and the technology to embrace that will mean everything, will allow hospitals to survive and endure through a protracted event like this.
Yeah.
Yeah, I've seen a lot of things change on the software side as far as visitor management, and managing visitors are kind of the unknown. You don't know who's going to show up when. And, just alleviating the stress of the visitors in the healthcare institution, I think relieves a little bit of the stress to the patient, because that stress can be transferred over, which could affect healing. So that's good.
Yeah.
So Doug, anything to add?
Yeah. From a clinical perspective, since we have like over 50 clinics here in Los Angeles and Orange County, basically a lot of people stopped coming to the clinics. They're all afraid to get COVID. So we really had to scramble to create the new technologies that we needed for telehealth. So we, looked at several vendors. We did a lot of experimentation on, what televideo companies we could actually use that would be successful for us. And we just went through a rigmarole of these vendors. And at the same time, I had to do vendor security assessments on each and every one of them. So we have to make sure that, whatever, we do with them, I mean, they have some kind of security in place to secure, the videos themselves, the information that they're gathering, on their end. And so it was really very challenging for us. And, we were scrambling, like almost like you guys were saying, almost practically daily, to figure out, how to get this, how to be successful during the time of COVID. And at the same time, for the all the clinicians, the nurses, the doctors, the employees at the corporate center, behind me, we had to come up with new rules, for them to come into the facility by, having these questionnaires, taking their temperature, making them wear masks, all those things. So it was really very challenging, and actually going to remote work. Remote work was another thing that we also instituted. So introducing multi-factor authentication, to our VPN, also to our OWA, which is Outlook web application. So there's a lot of things that we did that we probably would have never done before. And yeah, like you said, Colleen, I mean, it's a new world, and we're probably going to stay with some of the new processes that we implemented during COVID.
Yeah, absolutely.
Yeah, I mean, that was one of the follow-up questions. I mean, since we're on the COVID topic, as far as COVID impacting how we deliver healthcare, and what are some of the vulnerabilities did you open up over the past year, and changes that were made from the cybersecurity measures to adopt these changes? So, Colleen, if you could answer that, that'd be great.
Yeah, definitely. So, like anything else, when COVID, started to hit, it was like that immediate, March of 2020. It was like, okay, everyone start working from home. I think other panels I've been on over the last year, it seemed the theme was a lot of us were in the same position. We were like literally a couple of weeks away from doing a more enterprise rollout slower for Microsoft Teams and getting our Office 365. So it was like we had this, beautiful timeline. We're going to do this hospital this month. We'll do this one next month. And then it was like, we're doing everyone today, right? So we had a rollout that would take months, happen within a couple of days. So from a security perspective, that caused a lot of issues. We had people at home. Everyone didn't have, a company issued laptop. They were, some of them did, most of them did, but people then were scrambling to use their own devices. And then we had security things that we weren't ready for the, bring your own device or keep it at home. So, we had, senior level people, not able to get into systems because we weren't on a dime able to, create the access that was needed. So, that created a lot of gaps that we knew about, but because there was never a thought that within, such a quick amount of time that we would have to be accommodating people not coming into work and logging into the network properly and not doing those things. So that, and it drove, Doug, I can imagine on your end too, from a security perspective, our security team got inundated with like, we need to do this now. We need to do this now. We need access to this. You need to release that policy. We need to let people log in. And it was a challenge to, figure out what those right risks were to take and which ones we still sort of had to hold, hard on to say, we can't do that quite yet. So what's our workaround to not do that? So it was a lot of quick thinking, a lot of brainstorming, a lot of smart people figuring out, quick solutions. And like we've all said, I think we've all learned you can do things when you have to, So looking at sometimes then like, well, why did that take us so long before COVID? Are there ways we can adapt some more agile, technology or agile project management to things that, maybe we can take these risks a little bit more with, structure around them and deliver some things quicker. So I think those are the things that we're looking at as an output of COVID, like, hey, we are capable of moving quicker than maybe we thought in the past, and valuing, what that risk is and what we're willing to take. And maybe we're willing to take a little more because we accomplished a lot. Like, I think every hospital system will have very similar stories and be very proud of their IT folks and clinical folks and everyone on the team as to how they adapted and how we dealt with it.
Yeah, I mean, for me personally, I noticed a lot of the tents outside of the main facilities, and how do you, move what we have inside outside because, of the change that that COVID brought. So, Doug or Jim, any additional comments to?
Yeah. Basically, since you mentioned the tents, we had to really move really fast to put tents out at a lot of the clinics to do COVID testing. So we had to actually put in a lot. We actually had to extend our wireless network out to the parking lots and so forth. And at the same time make sure that they're secure. The laptops that we're providing are also secure. We're scrambling to put together laptops for all these users that were working remote. I mean, over 500 laptops we had to get out there as quickly as possible and do that securely and get everybody on remote, get them on VPN, get them trained, to use MFA, multi-factor authentication on VPN. And then at the same time, we're working with HR and legal to come up with the new policies for remote work. We had to have these guidelines. Some people were using their personal devices, but we were really trying to get them their own corporate laptops. So for the time being, we allowed that. And but we had we had them sign and read our policy in regards to the personal laptop. Don't print from home. If you're going to print at the at corporate site, that kind of thing. And if they had to do anything that went beyond our those new policies, we had to give them security exceptions. So we had to document that. And so there's a lot of things that we did. I could probably go on for like several hours to discuss all the things that happened. But just, it's just really scrambling. We really put a lot of stress on IT. And, they were doing as much as they could, as quickly as they could, to make sure that we're, creating a secure environment for the remote workers, also for the people coming into the offices who chose to come in. And, there's just a lot that was happening. And like Colleen said, we did some things fairly quickly. However, I don't think we really looked at or really took the time to really plan what we really wanted to do. I think that was one of the shortcomings of why we were going through several vendors, trying to figure out which one is best for us. We didn't do that requirements gathering that we needed to do, like a proof of concept, to choose the right vendor for this company. So yeah, there's a lot of lessons learned in what we did during the COVID pandemic.
Yeah, I would, absolutely second that. People mentioned the tents, and we put tents up quickly, very, very quickly, and which is all well and good, a tremendous plan. But you have to think through when you put a tent up, who's going to watch the tent? How are you going to safeguard the tent? How are you going to safeguard the equipment? All those mundane things come to the forefront. And another thing I think people need to take a look at when they take a look at COVID, it was in some ways came like a thief in the night, but there were also some historic challenges hospitals were facing prior to COVID. If just one was the surge of mental health patients that we see. 8-9 years ago, I'd probably get 1 or 2 kids coming through the ER a week who were suicidal. Now we'll get sometimes 25 a night. All that would come in without going on when you had COVID and you had to screen these people and you had tents going out. So, and I think from a IT perspective, you're when you put out laptops and you have a tremendous a migration of people working from home. You got HIPAA concerns, theft concerns, on and on you go. And I think looking at this, some of these changes or transitions will endure. I think we're going to see more and more people working from home. I could be wrong. I'm not Kreskin, but I think that'll be an enduring reality. So I think looking ahead, we're going to have to just take really strong steps in how we can ensure and guarantee, privacy, theft prevention, HIPAA violations, all those stuff is, and getting hacked. Those are things we're going to have to look at as we move ahead through a really uncertain world.
Yeah, no, that's interesting. Before we get off the topic of COVID and kind of shift gears a little bit, Jim, being the security director with the Seattle Children's Hospital, was there anything that kind of stood out specific to what you had to do, since you guys are taking care of the children primarily, and not adults?
One of the biggest challenges for us, we all obviously want to support the kids. If the children were tested positive for COVID and they were at the same time enduring like they needed mental health support, that presented some challenges for us because of the PPE issue, the PPE situations. We needed to make sure those kids are sick, and we hit that really hard, really fast. And for the most part, we enjoyed really good success getting the right equipment immediately. That took a few attempts, but that was a challenge. Making sure these kids, a lot of these kids are scared if they test positive. You can imagine how that could escalate concern. So safeguarding, supporting those kids, and at the same time, if their families here, sometimes we did have to work really hard with parents to make them understand visitation restrictions, that kind of thing, to a level I'd never seen before. And we did it, but it wasn't always easy. And I think those are challenges, and we're pretty good at it. But looking towards the future, we have to come to the reality that we may have to revisit that again.
Yeah, it's definitely a different dynamic when you are dealing with the child as far as a patient, and then the active parents that are totally concerned. You got kind of two different aspects that you need to focus on. So thanks for sharing.
Okay.
All right, Doug, what additional security vulnerabilities has the growing IT opened up? And what are some of the proactive ways CIOs and CISOs can defend against them?
So for the Internet of Things, one of the things that we actually started really doing was we have these AccuVax devices where we hold syringes and stuff and medications. Our biggest concern really was the fact that as an IoT device, they can get hacked. And because of that, we had to really look at our network and figure out how can we best protect, those AccuVax devices, and at the same time, protect the environment, our infrastructure. So basically what we did was we put together, we were looking at a VLAN, put them in their own separate VLAN. And so, that turned out to be kind of a problem because our clinics, the network for the clinics aren't really the best, when it comes to capacity, because we're still in the process of upgrading our clinics. So we decided to put them, on actually a wireless, on their own SSID for wireless. And so, we still are working on, making sure they're secure and coming up with a better process going forward for all our IoT, or all of our IoT devices. I used to be the CISO for a company that actually is responsible for infusion pumps. They're the ones that create them, build them. And so I have a lot of experience in that area. And we make sure that the vendor themselves are also testing these IoT devices to make sure that they're secure. And yes, we do on our end, we have our own responsibilities that we have to have, but to make sure that both not just AltaMed, but also the vendor is doing their due diligence to protect those IoT devices. So it's a big deal today, especially around the infusion pumps and other devices that can be used to do patient harm. And the AccuVax devices that we have all can do that because they're refrigeration units. And if they get hacked and someone can alter the temperature of these units, it would cause the vaccines to become, neutralize them. They won't be effective. So that's what we've been doing for the last several months.
Good. Colleen, Jim, anything to add there?
Yeah, our strategies are very similar, that we have, our wide area network, and then we have like some sub networks for those exact reasons. One for like clinical devices, that is, much more ingrained into the network, that it's harder to get to that outside of the network. And then we have our guest network. So, a lot of what Doug said, we experienced as well. There was things that, like, if we were still running, health systems are infamous for running things, into the ground, right? We have servers that are 10 years old, 12 years old, running versions of software that our security team are like, constantly like, we have to get off of this. And we were doing the same thing. Like, do we move it to a VLAN that it's sort of separate and that no one else can get to it unless you're like physically near that, that virtual, network. And then that causes issues because you still need other places, departments needing access. So that was a balancing act. And then we still have the providers who, are in their own good faith looking at new things, with a vendor of their own. And then, oh, here's an empty port, let me plug that in. And then you have the, years ago, you barely would notice that someone did that, and you'd find out they're running this whole application that you had no idea about for a couple of years. Now with security, we know right away, like, hey, wait a minute, something we're not familiar with got plugged into this port. Here's the exact place where it is. Go find it. And, then we end up with providers like, why are you unplugging that? And we're like, well, you can't use it. We need to talk with the vendor and go through a more formal thing. And that's the balance, like wanting to try something quickly versus, still trying to mitigate the risk and making sure it's safe, because things that can get hacked, people don't realize it until it happens. Right. And so, we're also doing a pilot for some RTLS, and we have temperature monitors, and we've been talking about security for those reasons. We don't want that system hacked into, that someone could start changing freezer temperatures on medications or deciding just to, turn it off. So there's a lot of things like that, that we look at as well, and learning every day and trying to make it better every day as well for everybody.
Yeah, I know the human factor is the big thing.
Oh, absolutely.
I deal with that all day long.
Oh yeah. Like,
And
what do you mean? It's
never
just
surprising.
it's just one thing, or a lot of things too, that providers, they'll want like some, videos of their procedures, and they again, in good faith, they want to do the right thing with it, but they don't understand why we, don't allow that USB port to be active anymore, because they just want to plug in their USB port and pull what they want and bring it home and do something with it, like in editing for a conference or something like that. Like I said, all in good faith. But those things you can't allow anymore, because there's PHI on there. And what if someone lost that and it, got into the wrong hands, and it had someone's information that they're not supposed to have. So
Right.
definitely a balancing act.
Yeah, and that's another thing where, because we're doing Zoom and WebEx
Oh, yeah.
and Microsoft Teams.
Yeah.
I mean, the biggest concern of ours for security is the PHI. We don't want people to share PHI, on these applications. And so, we actually had to get a product to do cloud data loss prevention and to actually monitor and make sure that nobody is doing that kind of thing. So we have to communicate that to all the employees on what they can and cannot do. And there's just so many things that, we ran into that we weren't really, we didn't really think about until it started happening. And so, that's just, the employee thing. Just as you guys see, going outside of the IoT arena is all the ransomware that we're seeing. We're seeing so much ransomware now. And so, fortunately for me, I really pushed to put security awareness into our, environment. We implemented it during the COVID crisis, and it really made a huge difference, because now people are more aware. So we're getting a lot of, we have a phishing button, you know, there to report phishing button on our Outlook. And so we
Yeah.
get a lot of that, but it's good. I mean, it can make us really super busy going over each and every fish that we're seeing that, but it's made a huge difference. I mean, we're actually ahead of the industry in regards to security awareness. So that's a really good accomplishment for us.
Do you have like our security folks, like I guess every quarter we'll do like a phishing campaign and send out emails to a set amount of people and see what their reaction is. Like, do they report? We have a phishing button as well. So they report it as phishing. Did they open it? Did they start entering information in it? And then we try to do some education. If there's people that, fall prey to it, more than once in the year, we give them a re-education video that we track to make sure that they took it. I'm sure you have something similar, I would think.
Yes, we're doing it every other month. Right now we're doing every other month because we're just trying to get everybody caught up, to all the, the social engineering that we're seeing out there.
Right.
And we actually have the HIPAA campaign is also tied to that too.
Yeah.
So we're going to start. I'm hoping I have a meeting with the corporate committee next week to see if we can do quarterly training instead of just annual training, but quarterly training, because there's all this new stuff that comes out that we really have to report that to all the employees on. And just sending an email doesn't do enough because they don't look at it. They'll say, oh, and they just bypass it. So,
right, because they get so much.
Yes, exactly.
Oh, yeah, and some of those phishing exercises are pretty appetizing with the the amount of money that they're willing to give me for just providing my banking information. So
right.
From our side in our company, the phishing is it's increasing as far as the emails that we get from our IT. Making sure that people are familiar and just it's top of mind. So when you do get those emails, it's something you say, aha, it is a phishing. So don't click, report,
Exactly.
Did you have anything to add there? No?
No, I think a lot of really good points have been made.
Okay.
Really good points here.
Good. Yeah, with the threat vectors, internal versus external, and protecting the infrastructure related to physical access control or entering the buildings. Are there any technology trends, and I'll open this up to whoever wants to jump in first, that you're seeing related to physical access control, whether it be more biometrics, mobile access, touchless environment where doors are just opening? So any trends that you're seeing related to access control, or we'll throw in RTLS in there for real-time location services. Anything that you guys are seeing there?
This sounds mundane and silly, but one thing that can really help reduce FTE is turnstiles done right at key entrances. I mean, again, access control, controlling, regulating, knowing who's in your building, coordinating that in a reasoned fashion where you can respond. And if you can stop long lines, that's a win-win. We spent a couple of years building that program. And, again, we're a fast food culture. No one wants to wait. And when people are stressed out, waiting is such an incredible hot button. It's just like, pouring gas on fire type thing. So turnstiles done right, if you work with the IT security, which we've done, can really help that process, especially with staff. If you have turnstiles and badges, you can just put staff through, and you can, right now we're doing self-testing at a station type thing. So that can help. And I think looking towards the future, looking at what's coming down the pike or what could come down the pike. And I think we have to embrace the possibility that we may be seeing other challenges. Turnstiles at key entrances, having that, building those plans, that'll help a hospital, especially a large hospital, in a big way.
Yeah. Yeah, I mean, we just recently, I'd say within the last year, before COVID, had put turnstiles in, and so the employee badges and the visitor badges, it helped during COVID as well. And I think now we're seeing the opportunities of the same single line out on the sidewalk in Manhattan has visitors, and it has people there for like maybe same day surgery. So, we're talking about how do we separate that? Like, if you're here for an appointment, you shouldn't have to wait in that line. We know you're coming. Can one of the lobby turnstiles be specifically for, you're here for surgery and you're already validated, and do you do an extra biometric thing there? So things we're talking about, something that's not going to be implemented in a day or two, but definitely things that we see, that, there's different reasons why people are there, and we shouldn't just assume they need to wait in the same line. And how
Right.
do you, because you clear them differently if they're there. Also pre-COVID, but we were actually able to leverage it. We were one of the first hospitals in our health system to pilot some RTLS on a large scale. So during COVID, it actually helped us because we were able to find our Alaris pumps pretty easily when we needed them. We also had our engineering folks like, hey, get me some tags, and I want to tag these HEPA filters, because, if we had to change rooms around for knowing where we needed those, that was very helpful to find those things. And as we know, RTLS can also do, that next level of, do I badge the person or the team member that's working in the hospital? And there's lots of reasons why you'd want to, but there's also lots of pushback about, how big is the oversight of knowing exactly where Colleen is every minute of the day. But from a security perspective, if God forbid something happened and there was a lockdown, you could have someone really see where everyone is. If they're in a vulnerable spot, if there is like you were saying earlier, like, we always get the active shooter, what's the word I'm looking for? The tabletop exercises we do once a year, God forbid that's real. That would be great to know, like, hey, we're locking down the 5th floor. Who's still there? You'd know by their badges if you had RTLS. But then when that's the once in a lifetime thing that most likely, hopefully would never happen, then you have like, do you really need to know I'm in the cafeteria for 20 minutes every day? But it's hard to have people understand. You're not looking for that. You're looking for the crisis mode of like knowing where people are. So that's a challenge to see how far RTLS will go on the person level. It's great for the assets, but I think there's still a lot of pushback on the person level of RTLS.
Yeah, there is some push. Yeah.
Sorry, Jim, go ahead.
Yeah, I mean, there's always that expectation of privacy some people have, but then again, like if you have an active shooter situation in a large building, there could be merit and huge utility in knowing what's safe when someone's in that type of thing. So I think we have to, as we move ahead, find a reason, balance that. Well, embrace that at the same time, respect. I've been in the cafeteria 20 minutes, that kind of thing.
Right, exactly.
Yeah, we don't, of course, we don't use that because we're not a hospital system. We're all clinics. So we do some really advanced stuff. Like we put the sanitizers out in front of the doors when they open them, so that way they can, sanitize their hands. I mean, that's as advanced as we got. But yeah, I did mention the fact that of having those automated doors, but that can get expensive. And as long as we have places where they can sanitize their hands, then it's not that important. I mean, the thing is that nobody can get into the corporate center without their badge. And, we do have good physical security. And even inside the building, everything's locked down. So like where our data center is located, that's locked down. You need to have a badge to get in. Just to get to different areas of the building requires a badge. And
Right.
so, that's pretty much as far as we've gotten in regards to, protecting our facilities. And we have guards also, on staff. They're at all the clinics, and they're also at the corporate center.
Yeah, I know privacy is always top of mind from the manufacturing standpoint and kind of the vision. HID Global has acquired a RTLS company, and we were primarily a physical access control company. So we're doing what we can to kind of mold those two together so that you can have the best of both breeds in a, sensitive to privacy type arena. So good. So we got 5 minutes left. And let me see here. Jim, a question for you. How can healthcare leaders establish, verify, manage, and protect the identities of people or visitors in their facilities? anything in addition to what we already talked about as far as like visitor management and employee rules, regulations?
Yeah, one thing we do, in fact, again, we right now, even pre-COVID, again, we screened everybody. And we also checked sex offender level 1, 2, or 3. We have rules for that. We did not run criminal background checks, but we did check for RSO. But we did build in the caveat there. And we serve and provide support for undocumented population too. And the big question was, well, if you take my information, will you be handing it out and giving it to me? So we, from the outset, work with IT to ensure and tell people, we do tell them literally, your information will never be shared, it'll never be touched. And that's from our perspective, has been a growing issue for families and visitors, where we run into people, well, why do you want it? That kind of thing. So we spent pretty much a lot of energy working with them, explaining to them that what they provide for us, if we issue them a badge, will not be given to anyone else, will not be available. No one can, hopefully no one can hack into that. And for the most part, that goes really, really well, but you have to build in the assurances that's the case. And I think from a hospital perspective, when you build a visitation program, you have to build in and incorporate into that information will not be available, that kind of thing. Because that's 5 miles of bad road. And when that has happened in hospitals around here, in a few cases, that kind of thing could end up like a HIPAA violation front page headline where, you want to move to Bolivia type thing. So I think those are things you have to do as you move ahead here. If you are going to validate, take people's picture and, confirm who they are, which I think you should. I think that's critical now for hospitals and healthcare people moving ahead. You don't want to allow unrestricted visitation, tailgating. But when you do that, just build in the assurances that their information will be held, will be safeguarded, will never be available for anybody else. If you can do that, I think you can build something really good.
Okay, Colleen, Doug, anything to add to that?
Yeah, basically, of course, our privacy policy that we have, and we provide them with a sheet of paper in regards to how we protect their privacy, and especially when they're filling out a form or something like that. A lot of the information goes into our EMR, so of course that's encrypted. It's also in the cloud, and we do validate on a periodic basis, to make sure that our data is secure, at our vendor, and at the same time, we always provide assurances to our patients that their information is being protected. And like Jim said, we don't want to get ourselves into, a situation where we're violating HIPAA and then we get fined. And so that's a huge big deal I think for all healthcare, all health plan, all providers.
Yeah.
So yeah, I think that's really just a given. It has to be done. Data has to be encrypted, has to be secured. We have to make sure we have good access control. So we don't want people to be phished, because that's how they get their access, right? Their user ID and password. So multi-factor authentication comes into the picture. So there's a lot of things you have to do to really make sure we're protecting our patients' information.
Okay, good. So with 2 minutes remaining, start with Jim, Colleen, and then Doug. If you could just give a couple thoughts, maybe 30 seconds, something in addition that we didn't talk about that you want to make sure that people hear. So if you could each take 30 seconds, starting with Jim.
Okay, 30 seconds. Okay. Don't assume that the world will return to the way it was. Humanity's in a portal right now. How we come out of this will be different. The world has changed. Plan and build accordingly. If you plan, prevention's everything. We have a concept, people have policies of zero tolerance. We have one of zero incidents. We don't want anything to happen. Plan that way. Plan, assume there could be additional pandemics, and plan there could be additional challenges like that, and build the redundant programs that will help you survive that and move ahead. That's what I would do.
Good, Colleen?
Yeah, and just building off of that, I think what's important, and it's always a battle, but I think COVID has made it a little bit more aware for executives and the financial folks of a hospital, that even if it's not the glamorous, new beds, new robotics in an OR, you still need to spend money and invest in your security, because at the end of the day, if you don't have that, none of that's going to matter. So taking care of the patients, everything, including the security of the systems and all of the infrastructure that goes like that. And I think, margins being what they are in healthcare, they're tight. And that's why I think we're challenged every day. All of us can probably have stories of things that are running for 10, 15 years and trying to get that replaced, and looking at the cost of those. It always seems to not be a priority, but I think COVID has made that more aware that we need to figure out how we invest and always have the most up-to-date technology that we can at the end of the day for the health systems that we all work at.
Good. And Doug, why don't you bring us home?
Yeah, so for me, it's about, the patient. So basically, we have a thing called the PACE program for the elderly, where we used to have them come in, we used to bus them in. Now we're looking at actually providing the care at their home, wherever they're located, because of what happened with COVID. So that's a new thing for us. And at the same time, remote work is here to stay. I know some of us will be doing remote work. Some will want to come to the office, every day. But I think, what's been happening over the last year, because remote work has been very successful for many companies. A lot of companies, especially the really large IT organizations, have gone to remote work permanently. But in the clinics, of course, you can't do that. But in corporate, yes, I think you can. And so I don't think that's going to go away anytime soon. But we have to, as security professionals, have to be prepared and have those right controls in place to actually monitor our employees, outside of the corporate environment, at their homes or wherever they go. So I think that's not going to change at all over the next decades. I don't think it's just going to be part of life now. The remote work and being able to, even if you're on vacation, I mean, you can do. They may have like some kind of a part-time. You're on vacation half the day, the other day you're working. That kind of thing. I'm hearing all these kind of stories from a lot of executives about this. So yeah, because of COVID, life has changed dramatically, and I think we need, as information security professionals, we also have to be aware of the emerging technologies. We have to be innovators, to the business, not just the CIO, but also information security.
Thank you, Doug. And we are out of time. So a special thanks to HealthIMPACT. Appreciate the opportunity for the attendees that were watching. And Jim, Colleen, and Doug, I appreciate your participation in the panel. So thank you.
Thank you.
Thank you very much.
Yeah, thank you.
Honor. Thank you.